Hello, my name is Jackie Stone, Product Specialist for Exubrion Therapeutics. Thank you for taking time to view this presentation. Today, I will introduce you to a novel radionuclide for the treatment of canine elbow OA. During this presentation, I will discuss the what, how, why, and when of Synovetin OA, acute versus chronic pain, and the mode of action of Synovetin OA. I will also discuss safety to the pet and the pet parent, and I will guide you through some radiation equivalence and public dose allowances. I will then move on to benefits to the pet as well as benefits to the practice when using Synovetin OA, and recommended pricing, who can treat with Synovetin OA, and what kind of support Exubrion Therapeutics offers to its doctors and practices. So let's get started. What is Synovetin OA? Synovetin OA is a once-yearly injection of a colloidal suspension containing the radionuclide tin-117 metastable and is considered a medical device and not a drug. Synovetin OA utilizes conversion electrons that emit discrete energy with a 0.3 millimeter penetration range that targets macrophage activity and helps to break the cycle of inflammation. Synovetin OA is proven through our clinical trials to provide up to 1 full year of pain relief, as well as break the cycle of inflammation, thereby helping to restore the synovium and joint to its normal state. In our safety studies of dogs and rats, no systemic toxic side effects or tissue necrosis have been seen. The long half-life of 14 days ensures a long-term therapeutic effect within the microenvironment of the joint, which we will talk more about in the coming slides. Synovetin OA eventually decays to harmless microparticles of inert tin and will naturally be removed from the body through the lymphatic system. So how does Synovetin OA work? Synovetin OA is a targeted therapy that blocks pain where it needs to be blocked, within the joint. Specifically, Synovetin OA targets macrophages and synovitis, which we know plays a major role in the initiation and progression of OA. The macrophage takes up the radionuclide inclusive colloidal suspension and by apoptosis, not necrosis, will destroy the macrophage as well as its inclusion pro-inflammatory mediators. As well, when the macrophage engulfs the tin-117 metastable colloidal suspension, it will take Synovetin OA into the synovial crypts, selectively destroying synoviocytes and thus restoring the synovial lining closer to its normal state. Let's talk about the inflammation cycle and synovitis. As an insult to the joint occurs and synovitis appears, an overproduction of macrophages as well as synoviocytes type A and B will appear along with synovial hypertrophy and angiogenesis. Macrophages respond with overproduction of pro-inflammatory cytokines as inflammatory mediators move in and out of the cartilage and synovial lining with patient ambulation, much like wringing a sponge in and out of a bowl of water. This will initiate and sustain cartilage destruction, causing chronic pain, inflammation, and further disability and instability. Without interventional treatment, a vicious cycle is sustained, causing the dog much discomfort and chronic pain. So let's talk about acute versus chronic pain, because I think it's important to understand the difference in order to understand the benefits of Synovetin OA. Acute pain is described as a sudden onset of short, sharp bursts of nociception responses. This is the conventional pathway to pain and is easily treated with acute pain meds such as NSAIDs and piprans. Chronic pain is much different from the fight or flight response as it serves no logical purpose. For example, what is the intrinsic value of having your joints hurt all the time? Chronic pain has historically been defined by duration of time, but in chronic pain, the NMDA receptors kick in, blocking receptivity to opioids. Chronic pain is very difficult to treat, and there are no agreed-upon chronic pain models by which to assess new treatment agents. While NSAIDs, piprans, and other modalities may serve their purpose with acute pain, chronic elbows become refractive to acute pain meds. Synovetin OA was designed to treat chronic pain where other common treatments are ineffective, costly, and do not treat the pain at its source. Now that we have differentiated acute versus chronic pain, let's talk about the gap in treatments for elbow OA. Since we know that OA is a progressive disease, dogs first showing signs of elbow OA may in fact have a positive response to common treatments such as NSAIDs, piprans, opioids, and nutraceuticals. However, since OA is a progressive disease, these patients will eventually end up in the chronic pain category. Currently, the only proposed treatments for chronic pain are PRP, stem cells, NMDA antagonists, and anticonvulsants. Results of these products are mixed and leave room for improvement. While surgical intervention is sometimes necessary to stabilize a joint, as with removal of an FCP or a UAP, OA will still progress and will need to be addressed. Synovetin OA provides targeted treatment for an arthritic joint needing surgical intervention, as well as for progressive OA once the joint is stabilized. Like most medical conditions, the best effect is seen when treatment occurs earliest in the disease. While we have shown considerable effect even in grade 3 dogs, the best effect comes with treating the dog at the earlier stages of the disease. The ideal patient is just presenting with pain or radiographic changes, where the administration of Synovetin OA can substantially slow the progression of OA. I challenge the mild cases of OA, as most dogs first showing signs of elbow discomfort have already been living with OA for some time before showing clinical signs of lameness. Hence, one could argue that by the time they show a lameness, they are already in a moderate stage of the disease. Radiographic diagnosis of elbow OA, even without a clinically painful joint, can still suggest a candidate for Synovetin treatment so as to halt or slow the progression to a more severe stage of elbow dysplasia. Radiosynovioorthesis is the technical term used to describe the procedure in which Synovetin OA is used. It literally means restoration of the synovium using a radioisotope. Synovetin OA, or Tin-117 metastable, is a radiotherapeutic device that emits low-energy conversion electrons. The injected radionuclide colloidal suspension penetrates the synovial membrane and is engulfed by macrophages, causing apoptosis and ablation of inflammatory mediators. This results in reduction of synovial inflammation. Tin-117 metastable is in a constant state of decaying. Ultimately, after 5 half-lives, the Tin-117 metastable decays, is cleared through the lymphatic system, and is sent to the liver as inert tin. I will now play a short video which captures and illustrates the mode of action of Synovetin OA.
Chronic osteoarthritis, or OA, is one of the most significant debilitating conditions in companion animal health, afflicting up to 20 million dogs in the U.S. Current treatment options can cause systemic side effects, are short-acting, or only target pain receptors, and thus may not fully address this disease that creates such discomfort for the dog. Inside the OA diseased joint, a vicious cycle of inflammation causes the synovial membrane to swell and the cartilage to deteriorate. The overproduction of inflammatory macrophages and synoviocytes creates ongoing progressive inflammation and pain. Synovetin OA provides long-lasting pain and inflammation relief by the dual targeting of these underlying drivers of joint disease. Synovetin OA is a veterinary device consisting of microparticles of the novel radionuclide Tin-117M. These particles are suspended in a colloid, which is injected into the joint to safely and effectively treat synovitis for up to 1 year. The appropriately sized Tin-117M microparticles stay in the joint and emit low-energy conversion electrons with only a 0.3 mm range of activity. This provides targeted, precise, non-systemic therapy with no clinically significant local or systemic side effects. Inflammatory macrophages and synoviocytes selectively engulf the Synovetin OA microparticles and are subsequently deactivated by the conversion electron energy. The microparticles remain active and are engulfed again by nearby synoviocytes and macrophages for sustained action against inflammation. Synovetin OA microparticles decay to harmless, inert tin, but its clinical effects last up to a year with just 1 injection, providing durable pain and inflammation relief and helping to restore active living.
I would like to shift now to the safety of Synovetin OA. Following our safety studies involving over 350 laboratory rats and 1 studying 5 colony-raised normal dogs, 69 companion dogs participated in our safety and effectiveness clinical trials. These dogs were examined at 1, 3, 6, 9, and 12 months following treatment. Various methods and exams on these dogs were performed to include joint fluid analysis, CBCs, and chem panels. No reported safety issues were seen, and all parameters were within normal range. For client-owned dogs, no post-care rehab is required, and dogs can return to normal physical activity immediately. Dogs can be treated and recovered in the general clinic treatment and recovery wards. It is important to note that while the low energy conversion electron emission in TIN 117 metastable is the therapeutic dose to the dog, there is an associated gamma ray exposure to the pet parent. Exposure is time and distance related. That is to say that the greater the distance from the source and/or the shorter time you spend at a given distance from that source, the less your exposure. To explain this, I have added some bullet points here for reference, as well as the next slide, which will show you radiation equivalence in real-world scenarios. The veterinary public dose limit is 100 millirems per year. Human public dose limit is 500 millirems per year. This means that patients receiving radioactive therapy or bone scans can be released into the public, and human caregivers can receive up to 500 millirems of radiation per year. If you are a doctor, veterinarian, or veterinary technician, the occupational dose limit is 5,000 millirems per year. For the smallest dog receiving Synovetin OA, this dose for the entire year of treatment would be approximately 40 millirems. For the largest dog with the largest dose for the entire year of treatment, the millirem dose does not exceed 90 millirems for the entire year of treatment, providing go-home instructions are followed. So you can see how safe Synovetin OA is, as at the largest dose we are still under the public dose allowed and well under the human and occupational dose. I put this slide together to show a tangible equivalence of radiation in real-world scenarios. You can see the Synovetin OA maximum dose and where it falls on this graph in real-world situation exposure. This is just to give you perspective. So what are the benefits to the pet when using Synovetin OA? No systemic toxicity effects as from corticosteroids and NSAIDs. No invasive surgery, although surgery may be necessary for joint stabilization. Up to 1 year or longer of therapeutic effect. No reported adverse effects to surrounding tissue. Patient can return to normal activity immediately. Synovetin OA is a targeted therapy, so the problem is being addressed at its synovial origin. And it's a once-yearly treatment as needed. The patient will not be burdened with daily, weekly, or monthly pills and shots, and it does not affect adnexal structures. Let's talk about benefits to the practice. While our first benefit and priority will always be helping dogs live a longer, pain-free life, there are other benefits to the practice. You will have an immediate top-line growth opportunity. This is due in part by not having any inventory costs. Treatment orders are patient-specific by weight and by date of treatment. Each order is filled for a specific dog and is not shipped until you collect payment upfront from the pet parent. You eliminate online or big box retail competition. Treatment with Synovetin OA is a low-touch procedure allowing you to treat multiple patients in a short amount of time, creating revenue for your practice. Based on a market survey, 69 million dogs receive care from a veterinarian on any given year. Of those, 17 million suffer from joint arthritis. 14 million will make it to the general practitioner for evaluation. 2 million of those 14 million are referred to a specialist, but only 900,000 actually go see the specialist. From that 900,000, only 600,000 will be treated. 500,000 of these cases will end up in surgery. There is a huge dropout rate between the referral to the specialist once the patient is referred to the specialist. About 1.1 million never actually make it to see the specialist. With Synovetin OA being a novel treatment for osteoarthritis, and more GPs gaining confidence that there is a better option, the pet parent is more likely to show up to that appointment knowing it won't always end in surgery or a disappointing treatment dead end. So what does this mean? Treating OA non-surgically is a $1 billion market. Unfortunately, the satisfaction rate for most current treatment modalities amongst practitioners is very low. This observation validates the need for a better treatment than what is presently available. Features of an ideal treatment would include safety, effectiveness, long-lasting, ease of administration, compatibility with other agents or drugs, non-opioid, availability, monetary value, source credibility, disease modifying. Synovetin OA meets most of this criteria. We suggest a price point to the pet parent of in between $2,500 and $2,800. This is for treatment of both elbows, which is most common. This was determined by a focus group of surgeons based on how long the treatment lasts, how effective it is, and it falls within the gap noted and right in line between more traditional treatments and surgical treatments. The cost to the veterinarian is $1,449 for a 2-elbow treatment, which is most common, and treatment cost to the veterinarian for 1 elbow is $949. We do offer certain incentive programs and rebates. These are fluid, so ask your product specialist for more details. As mentioned, Synovetin OA is a low-touch, time-saving treatment. Orders are placed 2 weeks before the treatment date and are specific to each patient, their weight, and date of proposed injection. Dogs can be injected under light sedation. Once a trained technician preps the dog, he or she can obtain the vial from the designated storage place and bring it to the doctor for injection. The veterinarian typically spends 10 to 15 minutes total time with the injection process. Prescribed doses should be administered on the date noted on the certificate, and under no circumstances should the prescribed volume be modified. Dogs can recover in the general ward and be released the same day with no restrictions to normal physical activity. There are go-home instructions and guidelines, but these are easy to follow and vary from state to state and are based on the final reading off the dog before it goes home. Dogs can be injected yearly as needed. Let's talk about who can use Synovetin OA. A radioactive materials license is needed in order to use Synovetin OA. Exubrion Therapeutics has partnered with the consulting firm FX Massey. Their nuclear health physicist will help you determine who will be your radiation safety officer, who will be the authorized user, and if there will be any supervised individuals. They will also prepare any initial license documents or amendments to a current RAM license. This is all free of charge. As well, FX Massey has put together the training modules for the authorized user and supervised individuals, and this is also free of charge. Exubrion Therapeutics offers a very robust support plan for all its doctors and hospitals. We just talked about licensing support and training. Your product specialist will also come and help train support staff at your hospital and can help you data mine for those dogs you've already seen that you can now bring back in for this breakthrough treatment. Additionally, we offer marketing support, GP outreach support, CE sponsorships, and so much more. In summary, Synovetin OA solves a large unmet need in the veterinary practice. Synovetin OA is long-lasting, is a targeted therapy, and breaks the cycle of inflammation. There are no client medication compliance issues. Synovetin OA can be used multimodally except for stem cells and PRP. Radiosynovioorthesis with Synovetin OA is a low-touch, minimal-effort procedure. And with Synovetin OA, there is a significant practice growth opportunity. Some important disclaimers from Exubrion Therapeutics. Injections should be performed only by a licensed veterinarian skilled in the administration of intra-articular injections, who's located at a facility that possesses a current radioactive materials license. Also, do not use Synovetin OA in dogs whose owners will not comply with release instructions mandated by applicable federal and state nuclear regulators. Thank you so much for your attention during this presentation. For more information on Synovetin OA, please contact me at jstone@exubrion.com, or you can reach me on my cell at 951-440-8440. For general information or for FX Massey authorized user training, please visit our website at www.synovetin.com. Thanks for watching.